Hi, my name is Christine Sloss, and this is my head-to-toe assessment video on my patient Estelle. Just looking at the patient, walking into the room, the patient does look well groomed and she looks well nourished. And I'm going to go ahead and introduce myself to the patient. Hi, Estelle. I'm your nurse, Christine. How are you today? Good. That's good to hear. Can I have your name and date of birth, please, just to verify? Estelle Davis. Thank you. 9/9/1999. Okay. Thank you. So do you know I know you said you were doing well. Do you know where you are right now? The hospital? Okay, that's good to know. And do you know what year it is? 2021. Thank you. And what brought you in today? You haven't been feeling well. Yeah, you've had a little bit of shortness of breath. Oh, and you do have asthma. Okay, that's good to know. I'm going to go ahead and take a quick set of vitals on you really quick. Um, so, taking vitals for the patient's blood pressure is normal. It's 130/84. The patient's heart rate is at 74. The patient's respirations, I'm counting at 21. And patient's oxygen saturation is okay at 95%. And a patient's temperature is at 98. So it doesn't look like she's running a fever at all either. Are you in any pain today? No? Okay, that's good to hear as well. I'm going to go ahead and take a look at your skin. Looking at the patient's face, extremities, the patient's skin does seem intact. I don't see any signs of scarring on the skin that I can see right now. No signs of lesions. The patient doesn't look pale or jaundice. And the temperature of the patient's skin does seem normal. Like I said, the patient's temp was 98. So the patient doesn't seem sweaty or too cool either when looking at the patient's skin. There is an IV in place on the patient on the right hand. The IV doesn't look infected at all. Can you feel any pain or tenderness in that area? No? Okay, that's good. Yeah, like I said, no signs of infection or redness. No signs of edema or any drainage from that IV site either. So I'm going to go ahead and take a look at your head really quick because the patient doesn't have any wounds or any scarring or anything. So the patient's head, when looking at the patient, is normal cephalic. The patient's head is in a nice round shape. The patient's hair, when looking at the patient's hair, it is all intact. I don't see any signs of shedding or your hair falling out. I'm going to look at your scalp. I don't see any signs of lice or anything or any lesions or scales on the scalp at all. I'm going to take a look at the patient's eyes. The eyes are symmetrical on the patient, and I do not see any signs of drainage from the eyes or anything, and Perla is also present. Patient's nares, looking in the patient's nares, no signs of a deviated septum. The mucosa of the nasal passage is moist. It doesn't look dry. And in doing a patency test, the patient's both nares, she can smell out of both. I'm going to take a look at the patient's mouth. Would you go ahead and open and say ah for me? Okay, looking in at the patient's mouth, the tongue is midline. Mucosa of the mouth is pink. It does look moist. I don't see any redness on the gums or the throat. Tongue doesn't look dry. Like I said, pink and moist, no cracks or anything on the tongue either. I'm going to take a look also in your ears. Looking at the patient's ears, I don't see any signs of drainage in the ears or anything like that. The patient can also hear out of both of her ears, and the ears are also symmetrical on the patient's head as well. Going to the patient's neck, I'm going to go ahead and feel your pulse on each side here, your carotid pulse. Both are palpable. Nothing is going too fast. The patient's trachea is midline. I don't feel any signs, or I don't feel any lumps or any bumps in the patient's throat, and I don't see any signs of jugular vein distension either in the patient's neck. So I'm gonna go ahead and listen to you really quick. Listen to your heart and lungs. Listening to the patient's heart. Okay, so with the patient's heart, I can hear S1 and S2. The apical pulse also seems to be within the normal rhythm as well. I don't hear any signs of a murmur or an arrhythmia present either. The patient's chest, looking at the patient's chest is symmetrical. I don't see any signs of scarring on the chest. Patients does have a normal rate. It seems like no signs of retractions or use of accessory muscles. I'm going to go ahead and listen to her lungs as well. Will you take a deep breath in for me? I'm going to go ahead and compare both sides in each section of the patient's lungs. Okay, I'm going to listen to the back here. Take a deep breath in for me. Awesome. Okay. The patient's lung sounds do sound a little bit diminished, but she did mention that she has asthma and hasn't been feeling well, so maybe her asthma is not being controlled as well as it usually is right now. Like I said also before, I don't see any sign or use of the patient's accessory muscles or retractions in the chest area. Next, I'm going to go ahead and listen, or just looking at the patient's chest and then onto the patient's abdomen. The skin of the abdomen is consistent with the skin of the rest of the body. Looking at the skin, no scars, lesions, or any signs that when looking, it doesn't seem distended or protruding. I'm going to go ahead and listen, starting in the right lower quadrant. Okay. So I can hear bowel sounds. They're normal active in each quadrant. Palpating each section, starting from the right lower quadrant. I don't feel any lumps or any palpable masses in the patient's abdomen as well. I'm gonna go ahead and check the rest of your pulses here, radially, brachial pulse, popliteal pulse, all do seem like they're intact, and I can feel a bounding pulse or a normal pulse in each section there. I don't see any signs of edema. Skin turgor on the patient does seem normal, less than 2. Looking at the patient's nails, I don't see any signs of clubbing or splitting or cracking. The nail bed itself does look pink. And like I said, skin turgor was good. Capillary refill, also less than 2. So I don't see any signs of like dehydration with that. Also, so we did our abdomen. Yeah, so everything does seem good there. Musculoskeletally, I'm going to go ahead and have you squeeze my arms. Okay, or squeeze my hands, sorry. Patient does seem to have normal grip strength. I'm going to have you push against my hands on your feet and then push back. Yeah, I don't see any signs of weakness musculoskeletally on the patient. The patient just seems to have a normal range of motion in all of her extremities as well. Thank you.